Hey everyone, Chris here from MedPrep2Go, and I wanted to ask you to please follow us on social. There may be links in the show notes, or you can find us at MedPrep2Go on Facebook, Instagram, LinkedIn, and now YouTube. We'd greatly appreciate it as we try to spread the word about MedPrep2Go and keep medical education accessible and affordable. Do you need a break from studying? Check out the Dr. Raj podcast, where he discusses topics such as wine with Jesse Katz, sarcoidosis with Bob Saget, Saving the Bees with Sydney S. Sill, and so much more. The podcast also features guest host Becca Spar, who focuses on leadership and connection, as well as Dr. Michelle Kulai and her Everyday Rooms segment, where she talks to patients to share their stories and the challenges that come with different conditions. Just search for the Dr. Raj podcast wherever you're listening now, and tune in for a variety of great guests and topics. Hey everyone, Chris here from MedPrep2Go, and welcome to another episode of our USMLE Step 2 Questions podcast. I'll be your reader for today, and in this episode, I'll be going over 3 gastrointestinal questions from our online Qbank. As always, you can read these questions and more on our website at medprep2go.com. And with that being said, let's get started with question 1, gastrointestinal 16. A 67-year-old man presents to the clinic with a 6-month history of progressively worsening abdominal pain that occurs shortly after meals. He reports significant weight loss during this period. His past medical history includes hypertension, hyperlipidemia, and coronary artery disease. He takes lisinopril, atorvastatin, metoprolol, and aspirin. He has a 30-pack per year smoking history and continues to smoke. Vital signs are within normal limits. On physical examination, his abdomen is soft, non-distended, and non-tender, with normal bowel sounds. Which of the following is the best next step in the diagnosis of this patient's condition? Is it A, abdominal ultrasound, B, colonoscopy, C, computed tomography angiography, D, esophagogastroduodenoscopy, EGD, or E, serum amylase and lipase levels? And the correct answer is C, computed tomography angiography. The patient's presentation of postprandial abdominal pain and weight loss in the setting of hypertension, hyperlipidemia, vascular disease, and tobacco use is most consistent with chronic mesenteric ischemia, CMI. CT angiography is the best next step for diagnosis as it can visualize the mesenteric vessels and detect stenosis or occlusion. Answer choice A, abdominal ultrasound, is incorrect. Abdominal ultrasound is useful for evaluating biliary and hepatic pathology, but it is not the best test for visualizing mesenteric vasculature. Answer choice B, colonoscopy, is incorrect. Colonoscopy is useful for evaluating lower gastrointestinal pathology, but does not assess mesenteric blood flow. Answer choice D, esophagogastroduodenoscopy, EGD, is incorrect. EGD can identify upper gastrointestinal lesions such as peptic ulcers, but does not evaluate mesenteric arteries. Answer choice E, serum amylase and lipase levels, is incorrect. Serum amylase and lipase levels are useful for diagnosing pancreatitis, but are not relevant for mesenteric ischemia. Key learning point: in a patient with postprandial abdominal pain, significant weight loss, and a history of vascular disease, chronic mesenteric ischemia should be suspected. CT angiography is the most appropriate imaging study to visualize mesenteric vessels and detect stenosis or occlusion. Question 2, gastrointestinal 17. A 35-year-old woman presents to the clinic with a 5-month history of intermittent abdominal pain and non-bloody diarrhea. She describes the pain as crampy and located in the lower abdomen. She reports unintentional weight loss and fatigue. She has no significant medical history and does not take any medications other than oral contraceptives. She does not use tobacco, alcohol, or illicit drugs. Her temperature is 36.9 degrees Celsius or 98.4 degrees Fahrenheit. Blood pressure is 115/70, pulse is 80 beats per minute, and respirations are 14 per minute. On physical examination, the abdomen is soft with mild tenderness to palpation in the lower quadrants, but no rebound tenderness. Laboratory results show the following: hemoglobin 10.5 grams per deciliter, leukocytes 12,800 cubic millimeters, platelets 450,000 cubic millimeters, erythrocyte sedimentation rate of 45 millimeters per hour. Which of the following is the best next step in the evaluation of this patient's condition? A. Colonoscopy with evaluation of the terminal ileum. B. Computed tomography scan of the abdomen. C. Endoscopic retrograde cholangiopancreatography, ERCP. D. Hydrogen breath test. Or E. Stool culture and ova and parasite exam. And the correct answer is A. Colonoscopy with evaluation of the terminal ileum. This patient's presentation of chronic abdominal pain, non-bloody diarrhea, weight loss, and laboratory findings of anemia, leukocytosis, and elevated ESR is suggestive of an inflammatory bowel disease such as Crohn's disease. Colonoscopy with terminal ileum evaluation for biopsy is the best next step to confirm the diagnosis and assess the extent and severity of the disease. Answer choice B, CT scan of the abdomen, is incorrect. A CT scan of the abdomen can help identify complications of inflammatory bowel disease, but is not the best initial diagnostic test. Answer choice C, ERCP, is incorrect. ERCP is used to diagnose biliary and pancreatic disorders and is not relevant for this presentation. Answer choice D, hydrogen breath test, is incorrect. A hydrogen breath test is used to diagnose lactose intolerance and small intestinal bacterial overgrowth, which are less likely given the systemic inflammatory findings. Answer choice E, stool culture and ova and parasite exam, is incorrect. Stool culture and ova and parasite exam can help identify infectious causes of diarrhea, but is not the best next step given the chronicity and systemic features of this patient's condition. Key learning point. Inflammatory bowel disease should be suspected in a patient with chronic abdominal pain, non-bloody diarrhea, weight loss, anemia, leukocytosis, and elevated ESR. Colonoscopy with terminal ileum biopsy is the best next step to confirm the diagnosis and assess disease severity. Question 3, Gastrointestinal 18. A 40-year-old man with a 15-year history of ulcerative colitis presents for a routine follow-up. His disease has been well controlled on mesalamine, and he has been asymptomatic for the past several years. His medical history is otherwise unremarkable, and there is no family history of colorectal cancer. Vital signs are within normal limits. On physical examination, he appears healthy, and abdominal examination is benign. Which of the following is the most appropriate regarding colorectal cancer surveillance for this patient? Is it A, colonoscopy now and every 1 to 3 years thereafter? B, colonoscopy now and every 5 years thereafter? C, prophylactic colectomy with ileal pouch? D, surveillance colonoscopy starting at age 45 years? Or E, no further surveillance is needed? And the correct answer is A, colonoscopy now and every 1 to 3 years thereafter. Patients with ulcerative colitis are at an increased risk for colorectal cancer, and the risk is related to the duration and extent of the disease. Surveillance colonoscopy should begin 8 years after diagnosis and be repeated every 1 to 3 years thereafter, regardless of disease control. Answer choice B, colonoscopy now and every 5 years thereafter, is incorrect. A 5-year interval is too long for patients with ulcerative colitis due to the increased risk of colorectal cancer. Answer choice C, prophylactic colectomy with ileal pouch, is incorrect. Prophylactic colectomy is not indicated in patients with well-controlled disease and no evidence of dysplasia. Answer choice D, surveillance colonoscopy starting at age 45 years, is incorrect. Surveillance should start earlier, typically 8 years after diagnosis, not at age 45. Answer choice E, no further surveillance is needed, is incorrect. Surveillance is essential even if the disease is well controlled due to the increased risk of colorectal cancer. Key learning point. In patients with ulcerative colitis, surveillance colonoscopy should begin 8 years after diagnosis and be repeated every 1 to 3 years due to the increased risk of colorectal cancer, regardless of disease control. And that will conclude this episode of our USMLE Step 2 Questions podcast. I hope you enjoyed it and found the information useful. Please be sure to follow us at MedPrep2Go on LinkedIn, Instagram, Facebook, and YouTube to stay up to date with our content. You can learn more and read other Step 2 questions at medprep2go.com. Happy studying! Hey everyone, Chris here from MedPrep2Go, and I wanted to let you know about our premium Step 2 Bundle podcast, which gets you all of the Step 2 secrets and our Step 2 questions podcast combined and ad-free. You'll also get early access to all of our Step 2 questions episodes before they're released public. The bundled podcast is available now, and you can save over 40% with an annual plan. Details at medprep2go.com. Hey everyone, Chris here from MedPrep2Go, and I wanted to tell you about our MedPrep2Go Step 3 Review podcast that features over 90 episodes and 40 hours of high-yield content from Dr. Ted O'Connell and Dr. Raj Dasgupta. This is a premium podcast that has already helped over 100 students pass their exam. You can learn more and subscribe at medprep2go.com.